injury, going to see my physio. Update on my lower back injury, going to see my physio right now. Belly breathing, compression, rest, arm movements, getting your support people to help you out. These are just a handful of things that you can do to help with the pain associated with early cesarean births. But my top 5 suggestions are in this free resource down below. So make sure you take a look at that. While it's never too late to start your cesarean recovery, there is an optimal window for scar massage, especially if you're doing it yourself, and that is in the first 6 months. So if you are able to, please get started, because scar massage can help so much with pain, with numbness, with weakness, with that C-section shelf. The list actually goes on and can actually implicate things like fertility and digestion. So scar massage is a pretty simple technique to learn, but will make massive impacts. And please don't hear that if you're past the 6-month mark that it's too late and you can't do anything. No, that just means you probably need a little bit more help, or different types of techniques, maybe some tools, maybe seeing a therapist in person would make more sense as well, but it's never too late. Start where you are. It's never too late. If you have never done scar massage before, start. You can be a year and a half, 2 years out and have never done scar massage, and you have a painful scar, start massaging. You would just progress probably a lot quicker. Now, please also hear that you will probably need to have a little bit more guidance, because your success with self-massage will plateau a little sooner than someone who's starting much earlier. So all that means is you'll probably need to connect with a perinatal therapist to do an assessment, just to see how you can continue to make gains. And for the most part, exercise is going to be a massive component of your rehab. I mean, it always is, but scar massage won't be the only thing that is going to help you with your pain, numbness, painful sex, weakness, C-section shelf, etc. Okay? If you're afraid of touching your scar, that's completely normal. If you are scared to even look at your scar, that's common too. And certainly if you're not a massage therapist or a physical therapist, there's a lot of overwhelm with learning a brand new skill and changing it or starting it for the first time on your own body. So I just want to acknowledge, first of all of that. On top of that, if this was an emergency cesarean, if this was a birth experience you did not plan for or want, this is a lot of mental load. So the first thing to do is bring gratitude to the situation. This was an emergency and it was a life-saving surgery. There's a lot more that I want to say about this, but it is actually the entire first module of my cesarean recovery program. I'm going to talk to you about the first tip that I use in terms of scar massage in the next frame. It depends on how early you start. It depends on how frequently you do your scar massage. It should be 5 minutes every day. It depends on your body. Every body heals differently. It depends on your circumstances. Some women have a chance to rest and some don't. There are many other variables and some that we cannot even control. That being said, if you do your scar massage 5 minutes every day, how long does it take to make an improvement? You will see an improvement in 7 days. You will see an improvement in your pain, in that tension, even appearance, depending on where you start. It can be as soon as 1 week. It is actually, it's always surprising how quick change can occur. And again, the sooner you can start, the better. When you're just starting out, your pressure is very superficial, meaning skin deep. The movements are small and slow, and you want to keep at a 1 out of 10 pain on that pain scale, meaning you can just kind of feel a stretch of the skin. But as you progress over the days and weeks and months, those techniques get more and more aggressive, really. And every mom I've worked with, they're always surprised at how deep they need to push and how deep they can push with not only no damage and injury, but actually with quite quick results. So again, it all depends on where you are in your stage of healing and what techniques you're using. The best advice is to connect with your perinatal therapist to get direct assessment with your body or to follow a rehabilitation program.